Good afternoon, and welcome to the first edition, period, of Public Health in Hollywood, with the first installment of World War Z in Hollywood, which I'll refer to as WWZ from now on, so you know what I'm talking about. So we've had a little bit of technical difficulties. Unfortunately, meant I got a little bit out. It's going to get to you a little bit past 4 for today. I really wanted to do a live feed. My laptop screen decided to stop working, unfortunately, and for some reason it won't let me do a live feed off of my tablet. So I'm having to record this and then upload it to Disease Forensics Facebook page so that you guys can watch it. So I'm sorry about the delay. Everything should be worked out by next week, which is would be our next installment 2 of the World War Z Public Health Project. So the format's going to be, since hopefully you've watched the first 27 minutes of the movie, because that's what we're going to cover today, which is chapters 1 through 4 of World War Z. We'll cover basically what was in those sections of the movie, and then I'm going to cover 3 points. And that's pretty much going to be the format. I don't want to, I could go on and on if I really wanted to, but I figure 3 points, and it's for lay people and professionals, and stick to that. That'll be a good way to do it. But if you guys want to comment, of course, don't hesitate to do that. When you share it, you can comment. You can throw questions out there. If there's something I can't answer, I will definitely point in a direction of someone or organization or somewhere where you could get help from. So, but I would really welcome the fact of making a really good discussion and forum out of this Public Health in Hollywood. Okay? So, what happened in the first 27 minutes? We have an introduction of the characters, right? So this guy right here, Brad Pitt, plays Jerry Lane. He is the main character of the movie. We have his wife Karen and their 2 children. And we have the UN Secretary Theory. And I have to say, it took me a while, because at first I thought when his wife would say his name, the UN Secretary, I thought she was saying Jerry. So it took a few times for me to realize that's not what she's saying, because I thought, how unusual that the UN Secretary has the same name as the main character of the movie. So we get introduction to those 4 main characters in the movie, and Brad Pitt is obviously throughout it. Theory comes and goes, and so does his wife. But even though his kids don't have, I would say, main parts, they're in for the first 10 to 12 minutes, somewhere around there with the movie, but they're the driving force for him doing what he's doing. So even though they're not there with him per se, mentally, they are what drives him to keep going and keep trying to find out about this virus that seems to be affecting everybody, right? Okay, so the whole show starts at first with the flashing of like news shows, talking about climate change, talking about this mystery disease. Red tide, I believe, is thrown in there too. So they're showing these screens, these snippets of news, of media, of these different diseases or different things that it can affect ecology. And that's how the show starts. So I thought it was a really interesting way to start it. I'm going to come back to that why in just a moment. So that's how we get introduced to what we're going to be talking about here. Something that would be typically very media driven, right? We move from New York City, or suburbs I should say. It opens up that they're in the suburbs. They go New York City to New Jersey, and then we end in the 27 minutes in an aircraft carrier, which functions as what's referred to as an ICP, an Incident Command Post. Now, when I had posted this originally, unfortunately, I made an error and said that we're going to end in Israel. Hopefully you guys, if you watch beyond the 27 minutes, it's no big deal. You'll be ready for the next one we're going to talk about. But I had originally thought that the 27 minutes, I misread my own notes, ended in Israel. So it was minute 27. We are going through minute 27, but minute 27 ends with them being on the aircraft carrier. Okay, where its function is the ICP, the Incident Command Post. So let's go back for a minute. Now, I told you guys before that I would make in reference to the book. The movie was based on World War Z by Max Brooks. That's what this is based on. Okay, so I thought the book was not a lot like the movie. As a matter of fact, I would just say it's a basis for the movie, but the format's totally different, because the book is someone going back and interviewing all those that have already survived this invasion, okay, of the undead, of zombies, of Zeke, and I'll go over why I'm saying it like that much later. But they've survived it, and they're trying to rebuild this lost civilization. So it's not really the same type of format per se. But when I was watching the introduction, and watching it to prepare for this, to look at it more in the public health perspective, and seeing all those news clips, there was a particular part that had came to my mind. So in the book, on page 57, it's supposed to be he's interviewing someone that had created this fake drug, basically. This fake drug called Phalanx, Phalanx, that was supposed to cure you or make it impossible for you to transmit this zombie type of virus, right? Okay, so he ends up peddling, and it turns out to be, it's not that truthful, it's a lie. This guy peddles it to make money off of fear. Okay, so the excerpt is the guy interviewing him is, and the person's name is Breckenridge or Breck Scott. Okay, and again, this is on page 57 of the book, and the interviewer says, but the virus wasn't airborne, and this was the person's response. It didn't matter. It still had the same brand name from the makers of. All I had to say was may prevent some viral infections. That was it. Now I understand why it used to be illegal to shout fire in a crowded theater. People weren't going to say, hey, I don't smell smoke. Is there really a fire? No. They say, holy crap, there's a fire, run. The guy laughs. I made money on home purifiers, car purifiers. My biggest seller was this little doodad you wore around your neck when you got on a plane. I don't know if it even filtered ragweed, but it sold. And it continues on, and that's the dialogue going back and forth. The interview is saying, do you realize that you sold crap? Did you realize that this was not truthful and you're making money? And the guy is reaffirming the whole time, Breck, is reaffirming that yes, I was aware that it wasn't true. He's making money off of fear. Okay? It's what people don't want to get. So this last part I'm going to read to you, because there's a lot to do with, I think the biggest connection between the movie and the book was the first few minutes in the movie showing those news clips. He says, but that wasn't because of Phalanx. Your drug didn't protect people at all. So that's the interviewer, okay? So Breck says back in response, it protected them from their fears. That's all I was selling. Hell, because of Phalanx, the biome sector started to recover, when in turn jump-started the stock market, which then gave the impression of a recovery, which then restored consumer confidence to stimulate an actual recovery. Phalanx, hands down, ended the recession. I ended the recession. So he creates this drug, Phalanx, that is strictly based on its lies. He knows it's not true. He just said it cured some viruses. It could, right? And that was enough for people, the fear. So when you see those news stories, and my mind always goes to, well, how truthful are they? I'm one to always check my sources, because having wrong, erroneous information can kill you more than the virus can. You do something stupid. And this is true with any outbreak. This isn't just with this fictional, right, this book or this movie WWZ. Okay, so we're in the burbs. Jerry opens up with Jerry and his family and his wife, and he's making breakfast, and there's something going on in the television in the kitchen, and one of his daughters sees it, and it's someone talking about something referred to as martial law. Now, why this is significant is you see by the way Jerry watches the television and the questions the child is asking him that he has a background in this. Okay, he has some sort of background in something that has to do with places where there's chaos, right? That's why that's significant, that scene. So then it moves to the next part of him going to New York City, and he's sitting stuck in traffic. His wife's in the front seat, his two daughters are in the back, and we really start to get an idea for Jerry being aware of his surroundings, okay? Being aware of what could be taking place that would signal him that something is not quite right. So he hears something flash on the radio about some sort of disease in another country. He's looking around. They're still stuck in traffic. Okay, him and his wife start noticing there's helicopters that have, few helicopters seen that have passed overhead. And shortly after this, keep in mind, picture the scene where he's stuck in traffic, and this police officer on a motorcycle, because that's all that could fit between the two, goes flying by and knocks Jerry's side view mirror right off the car. Officer doesn't stop, he just keeps going. Obviously something of huge concern, right? So when Jerry gets out of the car to see what the heck's going on, someone asks him if he was okay and so on, an explosion happens. You can see it not near him, it's somewhere down the street, an explosion happens. He's stuck in traffic. Now what is he going to do, right? So there's a garbage truck. He's back in his car, goes careening through traffic, and Jerry uses it as an opportunity to get the heck out of Dodge, just clearing all those cars. Well, in the process, as he follows them to get out of there, to get out of this traffic jam, they get distracted because of their daughter who took off her seatbelt, was starting to panic. Okay, I want you to remember that, the feelings that we're starting here now, they're starting to panic. Ends up climbing behind the seat, the small space between her mother's seat and the seat she was sitting on, and Jerry gets distracted, car accident happens. Now, the next scene that takes place, I would say, sets the pace for everything. It sets the pace for what type of character Jerry's going to be, his experience, and how valuable he's going to be to the movie. Okay. Now, what's significant here is Jerry's any other person. This is not a superhero flick. This is a guy who we found out later worked for the UN with investigations. He's not, he's appeared to be that his skills have been fine-tuned because of the work that he has done. Okay. They get out of the car, they go racing, they see people running everywhere. It looks like people are biting other people, right, acting crazy. And his daughter drops a toy that she was carrying in the process. So he goes back to get it. In the meantime, this is what appears to be, we find out later, is like a zombie, right? Goes after somebody in a car and is trying to attack him. Bites the driver. Now Jerry sees this whole thing and he stops and he's watching it. Well, he's got the toy in his hand and the toy is counting to 12. So he estimates, because it took the full length of the count, by watching that from the time the guy was bitten to the time he showed symptoms, took 12 seconds. Now that is incredibly significant. That's a very significant part of the movie, and we'll cover that why momentarily. Okay, in the meantime, they get in this RV, some other dramatic Hollywood stuff happens, they get out of Dodge, his wife calls, Theory calls them, which is the UN secretary, to try to get in touch with him to get his assistance. Okay. In the meantime, they realize her daughter, one of their daughters, who's asthmatic, is having a respiratory distress issue, and they don't have an inhaler. And we'll get to why that's significant later too. Okay. They end up in New Jersey because the UN is going to send a helicopter. Theory's going to direct them to send a helicopter to pick up him and his family. Looting's going on. Chaos is ensuing. It's not good. Okay, lots of emotion there too. It's absolutely not good. People are panicking. They're panicking in the streets, and it's not a good combination. They have to go into the store that's being looted to get medication for his daughter because of her asthma. Okay, well, in the process, things happen. Again, more Hollywood dramatics, which I don't believe is that far-fetched. I've never been in a riot situation, but I would imagine that to be pretty darn close to how it would be. His wife gets caught in a situation. She almost was harmed. And you see an officer run in who at first you're thinking is going there to take care of the situation, but he's there he's picking up baby food. Okay, so he's taking care of his own family. Not faulting that, because that's just insanity if anything close to this was really taking place. So they end up in this high-rise apartment building, because they're going to send a helicopter at dawn to pick them up off the top of the building. It's going to be the safest location to do that. Well, on their way there, you see a homeless man, an older homeless gentleman, sitting on the ground, drinking something out of a paper bag. Okay, now I would assume he's not in the best of health by looking at how the picture looks, but that's my assumption. I believe that's what they're trying to show you. And these infected people go running right by him. So why is it significant? We don't know yet. We don't know why, but it stands out that all this chaos is going. We watched in New York City that the zombie type creatures, right, were attacking and going after people, but this man they run by, this older gentleman, they run right past him. They make it into the high-rise building. They meet a family that's trying to hide out in there. They end up staying in there till dawn to get out of there, and tell them, why don't you come with us? Said to the family, you should go. Well, they're too afraid. They're petrified. So instead of leaving, they freeze, right? They stay there, which is, here we go with another emotion, right? We have people that are looting, or we have a situation where people are so scared they don't go anywhere. So Jerry gets prepared. He starts taping up like magazines around his arms for biting. He knows that they attack. He can see he knows that they're going after people, right? These are cannibalistic creatures from whatever the heck's going on. And he takes a knife and tapes it to the gun and creates like a bayonet. The next part is very significant. The family, they do end up making up the stairwell, right? But Jerry has to send his family ahead, his wife and his 2 girls ahead. He has to head off the zombie creatures. What happens though? They bite at the gun that he's now on his back. He's holding it up, trying to fight them off, and he gets some of their blood and spit in his mouth. He's screaming, and it's dripping all over him. He can see, and do we have an infection moment? Big deal, right? Do we have an infection moment? He knows if they bite, but now this would be through ingestion. The child saves them. That's from the family, because his family gets attacked, the one that was left in the apartment. And the little boy that was part of that family gets away and ends up going off with them. When Jerry gets up on the high-rise, when he ran out the door, he runs to the cliff, or the edge of the building, to see if he's going to have a reaction. What does he do? He counts to 12. Okay, he counts to see because if he starts having a change, he's going to leap right off of that building. That's significant. He's going by what he's already observed to be true. The person that was bitten and then started showing signs 12 seconds later, right? So he ends up making it from New Jersey to a aircraft carrier that's now functioning as an ICP, which is an incident command post. And you see there's a whole lot of stuff going on. There's military, UN is there. You see later there's doctors there. Everyone's trying to figure out what the heck's going on and how they're going to handle it. So this is pretty much it in a nutshell. The part that stood out to me was the fact that they're cramped in a ship too. So if there's any outbreak that happens on there, they're in trouble because everyone's cramped together on this aircraft carrier. So that's the movie in a nutshell. That's what has taken place in the first 27 minutes, right? Okay, now let's talk about the public health perspective of this. So I told you I'm going to cover three things, 3 points that are made that I can make to professionals and lay people about how watching this movie can be beneficial, how it could make you think about what you need to do. What I want to hit on first, which is rather significant, is this here. So, first 27 minutes of the movie, we're able to find out these things about the disease, okay? The symptoms. The people are aggressive, cannibalism, highly focused on their next meal. Now, why? You may be looking to start laughing and going, duh, yeah, why am I putting this on there? This is true with some viruses. Even in the book, World War Z by Max Brooks, he makes reference to the fact of one of the times it was called African rabies, because it was, they documented cases in South Africa in the book. Okay, documented cases in South Africa, and that was what people were calling it because it appeared like rabies. Why? Rabies attacks the part of the brain that makes its victim either act fearful or aggressive. And I'm speaking more specifically about animals, okay? Makes the animal or mammal act overly aggressive or overly fearful. That may not react to a certain situation. If it was in like a situation where people around, it would take off running out of there. Why? The virus is reproduced in the salivary gland, so it wants the animal to bite. It affects the brain that makes the animal bite. One encourages it in situations it wouldn't otherwise. They want to bite. It bites. It transmits the virus. So very important that we learn that the symptoms are aggressive, that it causes aggressive behavior, cannibalism, and highly focused on the next meal. We learn something called, that I'm going to refer to as the 12-second rule. That Jerry discovers from the time that the person is bitten is about 12 seconds, so they start showing signs like this, symptoms, okay? So who's not affected or infected? Who? Well, we get a sign here with the homeless gentleman, who's the older homeless gentleman, that, okay, he wasn't affected. They ran right by him. They didn't even show any interest in eating him for some reason, right? We don't know why yet, but it's something that is significant that we get to see. Interesting. And we find out we cannot acquire disease through ingestion or fomites. So what are fomites? Fomites are like inanimate objects, okay? Can't get it either way. They've touched a lot of surfaces so far that would have that virus on it. And they didn't get it, right? So far, we're not seeing signs of it. He had blood in his mouth from the zombie that was over the top of him, and he was stuck on the ground. So we know we can't get ingestion. He didn't show signs of it. Okay? So far in 27 minutes, so think about this, if you were doing epidemiology work or working out in the field and trying to figure out the cause or what's going on with the disease, I would probably be able to surmise the symptoms, the time from contact or acquiring infection to showing symptoms, who's infected and who's not, who's affected and not infected, and be able to figure out what are some routes that it wouldn't affect. Big deal. Because I'm able to say, okay, I know it's not aerosolized, it's not in the air, it's not. I'm able to figure those things out, which really helps determine if it was a real life disease situation. I'd be able to determine, oh, okay, well, it's someone that's got to be in close proximity, in this case bitten, right, to pick up the virus. It's not something that can travel in the air. It doesn't survive fomites or objects, and you can't get it by eating it. Okay, all important points. So the 3 points, especially in light of this kind of stuff, the 3 points that I want to make for this first installment are 1, okay, the reaction to emergencies, 2, emergency planning, and 3, using what's available. Now, I'm going to talk about those 3 points and give you some case studies and some things to think about for lay people and for professionals in regards to that. So, that passage that's in the book, that's in Max Brooks' book, is pretty significant. To have someone say that, hey, I preyed on them being ignorant. I preyed on them not knowing. Now, when I use the word ignorant, I don't mean it in an insulting way. I simply mean it that it's somebody who didn't have information. I'm ignorant of things, you're ignorant of things, everybody is. Okay, nobody knows everything. So ignorance is simply a statement of fact, that in the sense of that there's something that was not known. So that character Breck made money off the fact that other people did not know that his phalanx, that drug, that his little doohickeys would do absolutely nothing. It wouldn't do anything to help with the virus. He preyed on that fear. And anytime you would have a natural disaster or an outbreak, there's a heck of a lot of emotion. So it doesn't take much to manipulate. The way that you can be empowered as a stakeholder in a community is to make sure you're informed and you're getting information from a source that is reliable. That's how you stop yourself from being manipulated by people like Breck, because these people actually do exist, right? Or others that can benefit, mostly here financially, but benefit from your ignorance or your fear. Empowering about information is everything, okay? So there's a paper that I had read, it was a few months ago, okay? And granted, it's from October 6, 2016, but there's the paper, okay? So it's Understanding How People React to Risk. It's by J.A. Boudreau, and It's from October 6, 2016. I will post this along with the post, I'll post this first and I'll post you the references for it. He makes a couple of very interesting points in here. So I'm going to read to you just a paragraph and a half of some points that he made about how people react to risk. Okay? So let us begin with two stories. In April 2009, Mexico City was fighting the H1N1 epidemic. So this is real life. This is not fake. Okay, this isn't, I'm using again World War Z to talk about, to compare it to how you'd apply it to real life. This is true. Okay? The city, and H1N1 by the way is a influenza or a flu strain. The city was swept with panic. Rumors were linking various sources of fear. So drug traffickers, the economic crisis, state corruption, and earthquakes. So you have drug traffickers, economic crisis going on, state corruption, earthquakes that are all helping to make people very fearful along with this outbreak that's going on. Okay? From a sociologic perspective, these rumors revealed a lack of trust in national and international public authorities. In the end, however, the city's everyday landscape was transformed as people followed preventive measures. So wearing masks and not greeting with handshakes. In March of 2016, another influenza epidemic was feared. But panic did not take over the city. Instead, people knew what to do and what to expect. They wore masks and adapted their behavior. Very significant to being informed versus not. Trust in your source versus not trusting your source. If you don't trust, and I am speaking as a former federal employee, I do trust my government, the information that's given, because I look at it they do want what's best. They don't want chaos and hysteria and people to do stupid things and to make an event worse. That's not something that government typically aims to do. But I'll tell you what, if I didn't trust the source, I would be looking up myself. So don't sit back if there's something you don't trust. Don't switch the focus and say, oh, that's the government or that's whatever source, because that still doesn't take away the fact that you're the stakeholder. It affects you. So look up somewhere else. Try to find the information in another location. So another part, and it's a few sentences here, an effective approach needs to acknowledge people's lived experience and be politically constructed as a problem for it to become a socially accepted risk. We need to humanize our approach and speak a language people can hear, care. Okay, and I can tell you that's significant. Having been sent out to disease, to outbreak situation, I can see that seeing that you're genuine and that you care makes all the difference in the world. So now at this point I'm speaking municipalities and emergency responders. It is really important with how you approach it. Don't look at it like it's just about the response. Makes me think of in that movie Patch Adams. And the doctor, the one doctor, I wish I can remember his name. But he, very good, very, very good doctor, but doesn't give a crap about the patient. The patient's just a number, okay? It's just a file number. Robin Williams really looks at it that they're not treating the overall patient. They're not acknowledging that that's bigger than a file. That's what I'm asking for you to do as a public responder. Because the difference in how people respond to you, like we're reading about what happened in Mexico City, the difference of how they respond is how genuine you appear to be the information that you're giving or the instruction you're giving to people on what to do. Okay? So there was something that was interesting with me. I have worked as a substitute teacher, and I had to do some active shooter training, and a police officer came to the school, and we had an assembly. It was just for faculty on what to do during active shooter situation, which felt kind of surreal. You know, sitting especially in a school, talking about active shooter, definitely it sobers you very quickly. That you don't want to be in the mindset of it can't happen here, because then you don't see the warning signs. If there were any, you don't see them. Okay? So the officer was talking about that, getting out of that frame of shock that you can't see what's going on because you believe, one, it can't happen here, and that you don't acknowledge what you can do for yourself. That to sit back and simply wait for an officer to respond is not a good thing. That's not a good way to handle it. You really have to be proactive. So what do they recommend? Which we were trained the same way for the government too, is that you fight back. You find whatever's around you and you fight back. Well, that's what I'm saying we need to think of as a public health responder and as a community member. We need to be aware of what's around us so that we can fight back, so that we have resources available to us, whether it's information, whether it's making sure we have supplies stocked, that we are fighting back regardless of whether it's a natural disaster or a disease outbreak, that we are prepared. Okay? That to me is very significant. For public health responders, you can take this a step further. So there's something called, the acronym is called CIRC, and that stands for Crisis and Emergency Risk Communication. Really important that when we're communicating information to the public, like I've repeatedly said, that we are genuine, right? Being genuine is incredibly important. Well, one of the tips that they give, and this is, CIRC is something you can take online classes, and I'll post something later that can take you to it. You can take online classes on how to provide information to the public. I've been through some of their online videos through the CDC, the Center for Disease Control, and it's very good. Okay, so it says here's some top tips. Consistent messages are vital. Don't over reassure. Acknowledge uncertainty. Express wishes. I wish I had the answers. Explain the process in place to find answers. Acknowledge people's fear. Give people things to do, which is empowering people. Okay, that's the point. Not like giving them stuff to do to keep them busy, but tell them what they can do to empower them so that they can fight back against, if it was a disease outbreak, against a disease, if it was a natural disaster, against whatever is in front of them, so they can overcome it. Okay, and ask more people, so share the risk. Now, going back to the study I read from Boudreaux, right, and he talked about that the city was swept with panic, that they didn't trust the authorities. So having this CIRC training is something that could be very beneficial to prepare you on how you would address the public in a situation where there's a disaster of some kind, or something that requires some sort of intervention on a mass level to help the people in your community. Okay, so there's point number one, right? So point number one, how to react to emergencies. Well, point number two, emergency planning. Now I'm going to cover this in the sense of a professional and in the sense of a layperson. So I read an interesting report called the McKinsey report, which had to do with 9/11, and very sad reading it. Okay, because it talked about what went wrong, what happened, why, not in reference to the actual terrorist attack, but what went wrong with the response. What could be improved? How can we prevent any issues with response later? And there were multiple things covered. There was not a heck of a lot of training, planning. It was done for a terrorist attack prior. So there wasn't anything to this magnitude that was done prior to this terrorist attack. They didn't have what's called mutual aid agreements. There was nothing determined of, if you need to get such and such a supplies, who are you going to get it from? That you already have that established, so if you have to start using that, if you have to call in that mutual aid agreement, you know where to get it from. And the place that has it knows you're going to need it. So mutual aid agreements weren't done. Communication was very poor. They didn't have the communication methods that worked in a high-rise building. The high-rise buildings interfered with the devices they were using for communication. So planning was poor. On top of that, there wasn't the people that had assumed command horribly died when the first tower had collapsed, because they put the ICP in the tower. Okay, so they put the incident command post right in the tower, and when that tower went down and the people were killed, they were without a commander for approximately 30 minutes, which is a long time considering everything that was ensuing. And it meant that someone had to step up that was not part of the ICP, because the ICP, that command post, had collapsed. So someone outside of there that was not part of it that now had to assume command. Okay? A horrible situation. Absolutely horrible from start to end. Obviously the terrorist attack was bad enough, but things were complicated. Resources were put out that didn't need to be put out. the ones they needed, they didn't know where they were at. Departments, there wasn't a lot of communication because there's no liaisons between the fire department and the police department and so on. So there wasn't a heck of a lot of communication. Everyone's rushing into the site. They had people there they didn't need, rushing into the site to help, and yet they didn't know who the people were, what resources they were using. Planning is everything. And what's a really good one is what FEMA puts out, the Federal Emergency Management Administration, through Department of Homeland Security, has actually how to do an IAP, how to do an incident action plan. Great resource if you're watching this as a municipality. If you're watching this as a municipality, as a first responder, as a person that's even thinking about doing it. If you're in any part of government, in a clerk's office, it'd be a good idea to look that over and ask, what is the plan? And what role could I take if there was something? There's a lot of planning that goes into a lot of what ifs. I've had advanced training through FEMA courses for incident command, and we had our county's emergency manager bring up some very valid points about how you really have to know your industry in that county, in your area, and plan for it. And the one I thought was a great example she gave was, we have a lot of beekeepers in the area. A lot of beekeepers. And up here in northern Michigan, they leave for part of the year when it's cold, and they bring them back, and they bring them back in these gigantic semi-flatbeds. Well, she knows the schedule, and if God forbid one of those tipped over, so the semi's with it, she would know how to handle it with the bees being there too. So knowing your industry is everything. If you're an emergency manager, you would also want to know, and I can give you an example which I thought was another interesting one. I was part of a teleconference of emergency managers and how the avian influenza outbreak was handled in Iowa. And they were talking about different resources they had to pull in to help. So what some may call, I guess, unconventional, resources. So here we have, like how we do in Michigan, where we have a lot of industries that are built up around the car industry. You know, when the car industry started to go under, everything suffered, right? Anything that was a dollar made off of the employees or that business was affected by how well or how poorly the car industry was doing. Well, it's the same thing. You have these huge poultry facilities and these towns built up around them. And any dollar made off of the staff, will say the workers from the poultry plant had bought lunch, at these small local restaurants. So when they weren't there, the animals are depopulated. There's not, anyone working at those facilities, which means anywhere they shopped at now are not getting those dollars. So what happened? This huge ripple effect of all these other industries that were affected underneath. Well, the emergency manager in this one particular county was seeing this situation slip of there's no money coming in, which the concern was food crisis. So she had bussed in a mobile food pantry. So when you're aware of the industries in your area and you're aware of what could go wrong, right, then you prepare for them. And that's when something like having, FEMA's assistance, the Federal Emergency Management Administration's assistance through the Department of Homeland Security, it would make a really big difference. It helps you prepare. So now what if you're a layperson? You're a community. Every person should have an emergency plan. What do you do? If you're an emergency person, or you're a person in an emergency, in a community, what do you do? What I would like you to do, and after you finish watching this, go to ready.gov. Okay, so ready, READY.gov. Okay, they have plans on how to prepare your family. Just where would you meet? If something happened, your kids are at school, right? Your wife or your husband's at work, where would you meet if something happened and you couldn't get back to the house? Helps you think about things like that. What about dietary needs? If you have someone that's a diabetic or has a wheat allergy or nut allergy, what are the dietary needs for that person? Okay, what about medications that they may need? It helps you walk through and decide what would you do if those emergencies happen. Of course they happen when you least suspect it. In the veterinary field, we always laughed and said the emergencies always happen at 5 o'clock on Friday. Right? It's when your mind is already starting to shut down and you're done. You're done for the day, you're done for the week. You don't want to be caught off guard like that. If you have a plan that's already put together, and you're able to decide where and what you need to do, you're that much further ahead than if something did happen, right? Under that ready.gov, they also have cards that you can print out, so you can carry one in your wallet in your car, have their kids your kids have them in their book bags. That writes down those places, like where would you meet, okay? Writes that down. There's also a spot on there for doctors' phone numbers or other medical professionals, pharmacy phone numbers, which could come in very, very much in handy. If you're in a situation where phone lines are down in a certain area, you may not be able to look those things up if they're outside the area, right? So having that at your disposal would be very important in case of emergency. So emergency action plans, or EAPs, aren't just meant to be for the professional or the emergency responder. You should definitely be thinking about that in your own home and what would you do. There was a article done that was about Hurricane Harvey and out of Texas, of course, and it was called Report Assisted Living Residents Left in Peril after Hurricane Harvey hit. It was in the Houston Chronicle, written by Jenny Deem, and it was published on August 3rd. And the people, now these are people in facilities. These are not, in private homes. These are in adult foster care homes or other nursing type of facilities. And there's a memorable picture, and I remember seeing it on CNN or whatever news I was watching at the time, of seniors sitting in water that was up to their waist or chest. Okay, sitting in their chairs, they were left there. And this report that was done by the Texas Human Services determined that many of them didn't have an emergency plan. Sometimes people have to shelter in place. So shelter in place would be like, don't go anywhere. The weather's too awful. Just stay where you're at for right now. We're not evacuating. What do you do though? I mean, you're talking about people that require senior citizens that require complete assistance from somebody else. These plans were not done, and family members assumed that these facilities had these plans in place. So when Hurricane Harvey hit, and come to find out they did not, and people were left in awful condition. So use as an example that even if you're you take care of a plan for yourself and your own loved ones that are under your roof, if you have any loved ones that are in assisted living facilities, that are in adult foster care nursing home, you need to check with them too and make sure that there is an emergency plan for them, because if there is not, then you need to be including them in yours. Okay, so definitely make sure that's aware. So now we've covered the first one of responding to emergencies. We covered the second of emergency planning. Now we're talking about the third and last point here, and that is using what's available. Now, for professionals, I really say you should have something like this. Okay, this is the field laboratory, the veterinary laboratory and field manual. This comes in incredible handy when you're in the field and you don't have any ability to look anything up. So this was by Susan C. Cork and Roy L. Hollowell. This is older, it's from 2002, but it covers everything I would need to know about serology, basic information and collecting samples, everything if I needed to do it without having the ability to look it up. Okay, so everything under one book here covers wonderful information. There are survival guides for lay people that you should look up and see, and FEMA gives a lot of good information you could simply print off. You don't have to have a survival guide. It'll tell you what you need. Tells you what to look for. You can look up from places like the Red Cross that has first aid books. That what would you do? If you didn't have access to medical care right away, how could you improvise for that in your home? Okay. As a licensed wildlife rehabber, to be able to improvise, I can relate to that 150%. And best example I can give you that always stands out to me is I had a turtle that was hit by a car. Shell was cracked awful. And I had to figure out a way to be able to essentially lace up that shell to give it time enough to heal. So I used, a boat epoxy because I knew because I knew it had to be able to stand to be wet. I purchased some brackets from the dentist, an orthodontist, so the brackets that are on your teeth, like for braces. And I used fishing line, and I used the epoxy to glue the brackets onto the shell and the fishing line to lace and hold it together. Now, I did have to reapply it occasionally, obviously, but it did its job till it healed enough that I could release the turtle back into its environment. So you have to be able to do things, improvise in ways you wouldn't expect, and you have to be open to do that. The movie World War Z really shows that. You really get to see from Jerry Lane's character that he's used to being in situations where he doesn't have the ideal tools or the ideal staff to do what he needs to do, but he still has to figure out a way to get it done. Okay, so don't allow yourself to, you can fall into like a pit that you plan to the point that if something doesn't fit that plan, then it's like, what do I do? So it doesn't hurt to have a contingency plan for a contingency plan, and so on. So just kind of keep that in the back of your mind. Okay. So what did we cover today? The 3 points. What are the 3 points I covered? So the first one was how do we, as medical professionals or public health professionals and lay people, so as community stakeholders, because you are absolutely have a stake in your health and well-being of your community, how do we react to emergencies? The second point was emergency planning, so formal emergency planning that municipalities, first responders, and so on, that you would have to for any kind of large-scale event, right? And 3 was being able to be innovative. What would you do if you didn't have everything you needed to accomplish what you needed to accomplish? That how would you be able to be more open to and being available to address things as they're coming along? Okay, so I hope that you enjoyed the first installment here of the WWZ, or World War Z in public health. I look forward to our next one. Hopefully I can get the kinks a little bit more ironed out, that it'll be a live feed. That's my hope. Please, 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 you have questions, comments, put them in the comment line right down there. Okay? Let people know what you're thinking. You'd be surprised what kind of conversations that you can kick up. I really want this to be an open, type of forum. If there's something I can answer, I will. If I can't,